Welcome to this explainer. We're diving straight into that late-night panic literally every parent faces. We're going to explore why reaching for that go-to medicine bottle might actually not be the answer you're looking for.
You know exactly the moment I'm talking about, right? You're lying in bed, it's pitch black, and you hear every single cough echoing from the next room. That immediate, helpless feeling just washes right over you. Your kid is struggling, you're absolutely exhausted, and you just want to fix it. Right now. It's so incredibly natural in that moment to want to reach for a syrup, a pill, some kind of home remedy. Honestly, anything that makes the coughing stop. But before you pop open that medicine cabinet, let's just pause for a second. We really need to rethink that instinct. Here's how we're going to break it down today. First, the paradigm shift. Then, the medicine trap. After that, environment over medication. And finally, when to actually call the doctor.
All right, let's jump right into part one, the paradigm shift, redefining the cough.
So the absolute most crucial point we need to establish right out of the gate is this. The cough itself is not the disease. I actually want you to think of it like an internal cleaning crew. It's this highly evolved biological protective mechanism. It's specifically designed by the body to clear out unwanted mucus, trap foreign particles, and keep those delicate airways clear. And that brings us to a massive mental shift we have to make. You see, the wrong question to ask at 2 a.m. is, how do we stop the cough? The right question, the one that actually helps them recover, is, why is the child coughing, and how can we help the body work better? We've got to shift our mindset away from just stopping the reflex and start investigating the underlying cause so we can support what the body is naturally trying to do. But I mean, why the mess in the first place, right? Things like viral infections, seasonal allergies, or honestly, even just dry winter air can send mucus production into total overdrive. And all that excess mucus, it has to go somewhere. That's what makes this coughing cleaning process absolutely essential for your child's recovery.
Moving on to part 2, the medicine trap. This is why adult solutions fail in children.
Picture wandering down the pharmacy aisle at midnight. You're usually going to encounter two main types of meds. First up, suppressants. These work by reducing the cough reflex directly, basically turning off the urge to cough. Then you've got expectorants, or mucus-thinning medicines. Those are designed to increase mucus production and thin it out so it's easier to expel.
But here is the danger, what we call the suppressant trap. If you give a child a suppressant without actually addressing the root cause, you are basically turning off the vacuum cleaner while the dirt just keeps piling up. The medicine artificially stops the cough, meaning that unwanted mucus just sits there, building up inside the lungs. And when mucus gets trapped like that, bacteria can multiply like crazy, inviting some really severe complications.
Now, here is a biological revelation that kind of changes everything. Children are simply not many adults. While we have fully developed respiratory muscles, a child's breathing muscles are still developing. They fundamentally struggle to forcefully clear out massive amounts of mucus from their airways.
And because those muscles are relatively weak, giving expectorants to a child can totally backfire. Think of it like dumping a bucket of water on a spill that they just aren't strong enough to mop up. Increasing mucus production in a developing respiratory system doesn't automatically mean a faster recovery. In fact, it can completely overwhelm them and make the coughing so much worse. We really can't treat these medicines like harmless candy.
Okay, part 3, environment over medication. Let's look at some actionable solutions for a better environment.
Before you even think about rushing to the pharmacy, take a look around your home. Dry, warm indoor air actually turns mucus into this stubborn, thick glue. And thick mucus is incredibly hard for those little developing muscles to get rid of. On the flip side, pushing fluids and making sure they're well hydrated makes that mucus thinner, which naturally makes it a whole lot easier for a child's body to clear out. So if you really want to help your kid out, focus on these 4 pillars for the right environment: cool air, clean air, comfortable humidity, and enough fluids. Creating this kind of environment is honestly often the absolute best treatment you can offer because it perfectly sets up the body to just do its own job efficiently. Actually, wait, we need to bust a major parenting myth right here. Hot steam inhalation is so often thought of as the ultimate fast cure, right? But the reality is that sudden moisture shifts from intense steam can cause thick mucus to suddenly dislodge and trigger severe coughing fits. Not to mention, those traditional home treatments with hot steam tents present completely unnecessary burn and scalding risks for small children. Just not worth it. And that's exactly why modern medical advice strongly emphasizes prevention and steady, comfortable environments. You can seriously breathe a sigh of relief knowing that keeping the air comfortable, strictly avoiding smoke and other airborne irritants, and just letting the body naturally clear the mucus is far, far superior to resorting to those risky home remedies.
Oh, and before we wrap up this section on environment and biology, you need to be aware of a super sneaky culprit: postnasal drip. Lots of times, what sounds like a terrifying deep chest cough actually just originates from a simple runny nose dripping backward down the throat. This localized irritation is what triggers the cough reflex. Understanding where it's coming from is so much more valuable than just blindly guessing and picking a random chest medicine.
Which brings us to our final part, Part 4. When to call the doctor, knowing the red flags.
Always remember the golden rule here. A cough is merely a symptom. It's not the disease itself. When you go to a doctor, their main job is to answer one critical question: what specific disease or infection is actually causing this symptom?
You've got to trust your gut on this one and seek an evaluation if you see these red flags. We're talking about a cough that lasts for weeks without any improvement, any visible struggling to breathe, unusual lethargy or tiredness, or if the symptoms are rapidly getting worse instead of just running a normal viral course.
And when you do make that appointment, remember that you are the detective bringing in the evidence. To give your doctor the complete picture, you need to be ready to share the vital details. Did you just start using a new household cleaning product? Has there been any recent smoke exposure? What's their allergy history look like? Any recent infections or unusual travel? Seriously, these little clues are often what reveal the true cause of the irritation.
So, the next time that 2 a.m. cough echoes down the hallway, try not to let panic take the wheel. Don't immediately ask what medicine to buy. Instead, ask yourself, what is preventing my child from coughing effectively? If you shift your mindset from stopping the cough to helping them clear the mess, well, you both might finally get some sleep. But it really makes you wonder, doesn't it, what other quick fixes in our medicine cabinets are actually doing more harm than good?